Really, really important topic. We're going to be talking about women who ignore potential heart attack signs. So we've got Dr Ameet Bakhai, who's a cardiologist at NHS, who's going to really give a bit of insight into the rundown really on sort of what's going on. And Doctor, welcome to the show. Great to have you on board. Can you give us an insight into what this is all about, ignoring potential heart attack signs?
Yeah, so Jimmy, one of the things that I'm a cardiologist, but also a research director, and I have a real public health interest in: are we doing the things that we could do for prevention rather than waiting till the heart attack or the heart is weakened or a stroke, etc. And the Health Span survey, which is looking into the disparities between women and men, is actually showing, again, we still have a gap. We've done quite a lot of work with British Heart Foundation, NHS, lots of raising awareness, but the gaps are still there. Now, the survey was actually triggered because we were looking at plant-based ways of trying to lower your cholesterol and your blood pressure at the same time, so plant sterols, etc., which is really nice that awareness has led to this survey data. And the data is showing us that still there is a gap in understanding that women, first of all, have slightly different presentation of heart attacks than men. They don't always have the traditional, hey, there's a weight on my chest, somebody's bear hugging me, and they're trying to strangle me, and it's a pain down the arm, and I need to act on that. I literally just heard from a woman's friend who she had chest pain in the middle of the night. It was severe. It was bad for 10 minutes, but as she got towards reaching her daughter's bedroom, it went away. So she ignored it, and actually, fortunately, the next morning she got the pain again, and that's when they called the ambulance to get into A&E, and she was having really bad blocked arteries, and it was quite clear that early chest pain was a warning signal. But guess what? The rest, she went for rest, indigestion, or something I must have eaten, etc. So women explain away their symptoms more differently. They don't think, hang on, I had odd discomfort, I had nausea, I had my heart beating fast, I had some sweating. Actually, that could be a heart attack. Let me dial 999. Let me have that ECG from the paramedics. Let them decide, was this a heart issue that needed to go to us, to hospital, or actually maybe there's another way to look into that. So I think the whole system is not always culturally aware that actually the symptoms will be slightly different, but nonetheless we should be thinking exclude heart attack before we think it's anything else. No, sorry, Jimmy, it's a bit of a long-winded answer.
No, it was really, really interesting. It's I suppose as a topic we could sort of talk forever about it. I find it really, really fascinating in terms of, like you mentioned there, the sterols and other things as well. I must admit, Doctor, I take a sterol, a plant sterol myself. I don't profess to be qualified to comment on such matters, but so just really, I know when I've tracked it a little bit, I know it's probably not a lot of time to go into it. I want to sort of focus on the sort of symptoms again. But what's your take on sort of steroids? I've been thinking about that. I've done my own research.
Nice. Yeah, thank you for that. So these plant sterols, and it's hard to get enough of them in your diet. And I think you being from Australia, people are really into their self-empowerment ways of knowing their lifestyle choices they can make to reduce their risk of death, stroke, heart attacks, strokes, etc. Dementia, and all these things. And what you're doing is you're beefing up your good cholesterol, you're reducing your blood pressure, you're lowering your bad cholesterol, and you're doing it through polyphenols. Now, we know that the polyphenols are improving your gut biome, and that's improving your inflammation in your body. That's improving your immunity, right? It's also reducing your absorption of bad cholesterol in the gut. All of these ways are really important of improving your cardiovascular. So dark chocolate, a little piece of dark chocolate a day. Beetroot juice in the morning to lower your blood pressure. Pomegranate juice to increase your HDL, or black grape juice. So Welsh's black grape juice, for example, was tested in a clinical trial and showed it increased HDL, good cholesterol levels. But we need that research evidence, we need the clinical trials, and we need to see the scientific data. What's the approach that we're trying to do here? And this is why I think olive oil is a really interesting area, because it not only improves your cholesterol profile by stopping you absorbing bad cholesterol, but it's also helping your blood pressure at the same time. So you're getting 2 for 1 in some of these supplements, the plant sterol-based supplements that are moving towards polyphenols and tocopherols. Now, in terms of the supplementation, you never want to over-supplement to the point where you're gaining weight. So naturally, don't eat so many a big bowl of olives, etc., because the salt and the calories in there. So there's a way to try and balance. Hey, what's the right proportion? And there, I think supplementation is probably easier than lifestyle. How much should I be eating? How much should I not be eating? Is there a scientific proportion that I should have beyond which we getting too much? So I think there's certainly great data at the start of knowing this is an area of interest. The trials aren't perfect, so we're still trying to design the right trials. We're trying to get a clearer signal. It isn't as easy as medications, where with clinical trials with statins and antiplatelets, we do large trials and we follow those patients really carefully, so we can tell you there's a 20% reduction in death, stroke, or heart attack over the next 5 years if you take aspirin, if you take a beta blocker, if you take a statin, if you take this for stroke reduction. We haven't as clean data with the supplements, but also we don't have the financial investment made by the companies to do these large trials. They're really expensive, these trials, to give us that definitive answer.
Yeah,
so lots of areas to think about, Jimmy.
It's really interesting, and for me, Doctor, I found that a minefield when I was trying to look into what to eat for sort of cholesterol and blood pressure. And I started sort of eating salmon and fish again, and I started to eat.
Really fish.
Yeah, and I started to eat nuts in the diet and oats as well, and obviously the foods you've mentioned there, and it did make a difference in terms of sort of cholesterol. Certainly did do. I even took like a supplement on steroid too, as well. To be fair, but
interestingly, Jimmy, this particular health span plant sterol also has niacin or nicotinic acid.
Oh, okay.
Nicotinic acid also lowers bad cholesterol, and so if you're doing the oily fish and the omega-3s, which will reduce your triglycerides, you're doing this one to reduce your LDL. You're doing absolutely all the right things there, and you're using the oats and the fiber, etc., to not absorb bad cholesterol from your gut. So you're doing brilliantly there.
Yeah, no, that's sort of. Which one was the one that you were referring to there? I'm going off track a little bit.
The HealthSpan plant sterol is the one that's just come out. If you go to HealthSpan's website and type in cholesterol, check that one out. And you'll see that it does two things. It's trying to improve your cardiovascular risk profile with lowering blood pressure and lowering your bad cholesterol, because it's got a combination of these agents. So you're getting the olive oil, you're getting the nicotinic or niacin, and you're getting sort of a general polyphenol hit, etc., plant-based hit.
Yeah, and I'll check that one out for sure. I take CoQ10 as well too. I've sort of started taking that as well.
That is so good. So you probably exercise quite a lot.
Absolutely,
so you're trying to recover your muscle health. So actually, for my patients, I do recommend, if they're getting side effects on statins, I do recommend they take coenzyme Q10 supplements.
Yes.
And I do recommend the sort of 300 milligram dose. And about 1 in 3 people will have a really good result with the supplement that they can carry on with the statin. 1 in 3 will have a partial response, and 1 in 3 won't have a response. So we have to stop the statins, and we have to think about the injections of PCSK9 inhibitors and so forth. We have to go different ways of lowering cholesterol, ezetimibe, etc. But the people who respond, the 2 out of 3 that respond, half of them get a dramatic response. Oh my God, my muscles are so much better. Thank you so much. I can mobilize better. I can exercise now, whereas I couldn't before. So that's possibly why you're doing it, Jimmy.
Yeah, and absolutely. That's really helpful information. And the trouble I found is that there's so much sort of misinformation out there when you sort of start this sort of journey. Or at least there was so much information out there. It kind of got overwhelming. So I think it's sort of, reassuring to speak to someone who's obviously sort of qualified to talk about these matters really. And that's the frightening thing I find, Doctor. You just get these sort of videos and people I sort of sometimes question their credibility. They talk about things, it kind of really can be overwhelming,
So we're talking not only about the overwhelmingness of too much information and not trustable, but also social media itself is so overwhelming. So what you're talking about there is almost also cognitive overload, Jimmy. And so, and not having the clarification. For me, I would, for example, go to PubMed. We look up the publications. I always, if I'm doing clinical trials, I will always try and publish or be part of the publication group. So we're, all pharma trials are registered even before they're conducted, so that there is a promise that whatever the results are, good or bad, we will actually publish that data so that it's there in the public domain. So people can actually see, hey, this didn't work, as well as this worked really well. So you actually publish what didn't work. Now, social media is not going to publish, oh, this didn't work. Who's going to look at, this didn't work, this didn't work, this gave me bad side effects, this made things work. Who's going to look at that, right? So there's a publication bias, as we call it. So I think you're absolutely right. It's a very hard place to steer, not a good place to be, which is why I think a research-based and scientific approach, and actually working with a company that's been there for many decades and doing the right thing for ages and wanting to show that scientific approach and doing studies, that's the best way.
No, absolutely. And just on the sort of signs, I know it's difficult. Everyone's going to have, I'm guessing that everyone's going to have different sort of potential signs and symptoms of a potential sort of heart attack. But generally speaking, Doctor, it's sort of things that people, and I don't want to worry people. I'm sure that people might experience it.
Right.
Yeah.
There's a balance to that, and you're right. But any new chest discomfort for more than 10 or 15 minutes that you can't explain away, it's not a sharp one, hey, I got hit here accidentally by a tennis ball because I was playing this, or I overstretched, etc. Anything like that, it's actually a pressure, or I've got new nausea with a discomfort with my heart rhythm being irregular. Those are the things I want people to take seriously. I don't want them just to ignore them, because we find so many people too late when they've got 3 blocked arteries and need a bypass. So raising that awareness, having the data back to them, knowing their cholesterols and their blood pressure, and then them taking action. Those are the 3 things we want, Jimmy.
Absolutely. And I mean, you can get sort of like these sort of like smartwatches now that have all sorts of things on there as well. And I mean, I must admit, I've got like an exercise one that tells you how much, sort of gives you an idea roughly. I don't know how accurate, reliable it is.
I want you to be a little bit careful there. So while we're really happy that smartwatches are helping us find more patients at risk of a stroke by detecting true atrial fibrillation, so the Apple Watch, for example, has got an ECG built on it, and the Cardio Alive Core credit card can help you find more atrial fibrillation if you're getting an irregular heart rhythm, etc. So palpitations or butterflies. There are a lot of alerts, noise to signal ratio that will make people quite obsessive about, oh my God, there's something wrong, etc. So you can get a little bit overloaded. Again, that's another minefield. You need to be with somebody who understands which of these watches are really evidence-based, which of them are actually just making claims that aren't really substantiated. So again, it's the same as choosing the right supplements.
No, absolutely, yeah. And I think that's a great point. Certainly it's easy to sort of really start to obsess over the data as well. And I've got to the point where I just use it basically to get an idea of when I do exercise and go for a walk, what the heart rate is and that sort of stuff. But it's been great speaking to you. It's been fascinating. So it's not very often we can sort of speak to a cardiologist. So I want to thank you for your time and coming on board. It's been really informative. I'll definitely check out the sterile, that's for sure. I'm going to have a look at that as soon as we wrap up. So thanks again for your time, Doctor, and all the best.
Thank you.